Hi, my name is Katie Owens. As president of the Healthcare Experience Foundation, we're focused on providing you, the healthcare community, in particular in this session, a resource on how executive teams can build trust and confidence across their workforce during crisis in these unprecedented, uncharted territories of what COVID-19 has brought to our communities and to our health systems. We believe every person is worthy of an environment where they can deliver and receive the best healthcare experience and have an amazing team of coaches that have walked in your shoes to create cultures of excellence. We have three brief things that we want to support you with. Understanding and empathizing with the crisis reality that we're in right now. Discuss three strategies of communication, visibility, and amplifying your rounding, and review some next steps that you can take. The crisis reality. This is just a small snapshot of the differences that we are being exposed to right now, from headlines on every single news site, empty store shelves just 3 weeks ago when we could easily access toilet paper, memes that despite the seriousness of this pandemic still might make us chuckle, and some that might make us cringe, plus a myriad of things that are hitting us as senior leaders, as well as our employees, physicians, and our patients. School closures, restrictions, the stock market tumbling, cancellations, do we go or not go on a cruise, daily changing protocols, shortages, preparation and variabilities across different hospitals and health systems nationally and in our own communities. And that impacts our team members who are working at different places and experiencing whiplash. And the daily changing perceptions of what might have felt like safe care, clean environments, and a normal healthcare experience. And as Kathleen Lynham on our team says, when people fear, they cannot hear. So at the end of the day, this is all about relationships, whether it's COVID-19 or any other crisis that we are facing as a senior team. We can best respond to build trust and confidence through our communication, visibility, and rounding. So let's start with communication, because we want to be fragile and handle it with care. Perspective matters. We see things not as they are, we see them as we are. And reality can be so complex that sometimes equally valid observations can be contradictory, because we see our intent and others see things from their lens and a very different perspective. And one of the challenging things that we face as coaches is sometimes having to give difficult feedback, that how we as a senior team see our intent and how deeply we care about our workforce during trying times like this. Employees don't see us as often as they need to know how much we really do have their back. Perceptions are predominantly shaped in three big ways. The direct observations that we see, feel, and experience, word of mouth and word of mouse, and what we're experiencing when it comes to social media right now, and the opinions shared by employees who work here. And I just remind everyone that in the absence of information, individuals create their own stories and interpretations. So as a senior team, as you plan communication, get to know their starting place and make sure we're all coming from the same place. We want to help you avoid 7 common pitfalls. Assuming employees know. You are getting minute-by-minute updates, conference calls, conference room time. Don't assume employees know everything that you're doing behind the scenes, or that they automatically know how much you care and deeply want to support them right now. Failing to share or not taking credit for the work. Assuming managers and directors are sharing the information, because that game of telephone can warp and get very, very different. And sometimes even the best of intentional managers with the best intentions can inadvertently throw the senior team under the bus. Not telling the stories. You've got employees doing extraordinary things to prepare or intervene right now. Sharing only the negative. Not having an open forum. And open forums are changing. So whether you're doing Zooms or WebExes, or if you're using your cell phone to record yourself and get the messages out, have ways that employees can get messages back to you. And please don't assume that policy updates always address anxiety. Because the reality is when people are stressed, only 7% of what they hear are the words coming out of your mouth. The remaining 93% of it is tone of voice and body language. People need to see your intent from the most primitive parts of their brains. When it comes to visibility, we want to be vulnerable and be real and genuine. Being present at the easy things like the start time for huddles during peak times, off shifts and weekends. And we would recommend that it's the entire team's visibility, not just nursing or clinical executives, but the whole team, the CFO, HR, CEOs, COOs, information officers. Show a unified senior team. So do explain the why for our intentions with patient and employee safety. Ask employees for examples of excellence that they've seen. What does preparation, or what are the wins for intervention when we have the COVID cases? Share those excellent stories. Listen without defense. Take note, offer to get back and follow up. Don't debate. Ask open-ended questions. We only get so far with closed-ended yes or no questions. Share your commitment to their voice and what they're saying matters, and express your gratitude. Now more than ever, employees are faced with more and more challenges. School closures, a whole host of things. They are making a choice to come to work and bring their best every day. Don't blame or ask why staff are anxious or angry. We can't fight emotion with logic. Focusing only on the negatives. Defend or dispute their perspective. Absorb it and share your intention. Avoid being visible during the difficult times. Failing to share the successes and opportunities, or being afraid to show vulnerability. There is no easy answer right now, and none of us know day by day, week by week, where this is going to lead. It's okay to be real. So let's look at performing. It needs to be a team-based approach across the entire senior team. All departments should have the benefit of senior leader visibility. If you need access to sample calendars or something like that, we're glad to provide it. Have a planned message and inquiry. Take the opportunity with the goal being listening and understanding actions and trust. Because remember, people need to see our intent. So some sample guidelines, have headlines, know the memory drivers that you want people to hear and repeat. Explain why we're doing this. Describe what success looks like right now, and we know that's going to change. Be real about the concerns. Enlist and ask people specifically what you're asking your employees or physicians to commit to. Here's an example from a recent organization. We know this pandemic has created challenges, fears, and safety concerns here and at home and in the world. We are committed as a senior team to being more present, sharing what we know, and listening to what you are seeing and hearing. We will be stronger for this challenge, and know that if we keep supporting each other, listening to each other, and providing the excellent care we always have, we'll get through this. I need to ask for your vigilance, helping us see the blind spots, sharing concerns, and sharing the success stories. So some 6 key questions to ask, and we've highlighted these because you can really fill in your own blanks here. What are you most proud of here with our preparation for that first case? Can you share with me a time when you felt administration did a good job responding to your concerns about this pandemic? Are there times that we've disappointed you? What informs your perception of patient safety? I would also advocate you ask your employees, what are they hearing from patients about their perceptions of safety right now? Can you share some examples of how we could have communicated or shared information better? What can I do right now to support you? And then connect the dots. As a senior team, if you're running as a team-based approach, you've got to communicate and share what you've learned and what you're doing. And that will inform you and empower you to make macro decisions. And then departments feel like you've paid attention to their needs, which is a key driver of employee engagement. We've listened, here's what we're working on, and here's what we need to work on next. So to wrap up, here are some steps you can take. Understand perspective. Always frame yourself and step into the shoes in the department you're walking into. Be intentional about your communication as a senior team. Plan for the entire team's senior leadership, rounding and visibility. Follow up, practice for the tough questions, and going forward, the reflective practice is so important as you go forth and operationalize. And while we certainly do not have a crystal ball for this or anything in the future, what we can guarantee you is that as a result of this work, these 3 recommendations, you will emerge as a stronger organization with better trust amongst senior leadership and employees. If there's anything myself or our team can do to support your success in this challenging time, please reach out to us. Thank you for the opportunity to serve you.